Hey, how's everyone doing? This is John Mark Talagrand Jr., clinical pharmacist. Just wanted to say that with all the recent, actually like post-COVID, with what we've seen with the field of pharmacy, in particular retail pharmacy, with many pharmacy departments being closed, staffing issues, in particular when in regards to New York City, where this is something that is relatively unheard of, to walk into a pharmacy and see it closed because, not because there's a particular issue, but because that issue is the fact that they don't have a pharmacist to work that particular day or to keep the pharmacy open. It's something that was unheard of, or has been unheard of historically in our field. And I just want to say, for all of the pharmacy interns and students who are getting into the field or into their studies, or potential or prospective students that are thinking about becoming pharmacists and joining the field, I just want to say that even though things may look bleak and you may hear talk of the profession, quote unquote, being a dying profession, this could not be further from the truth. In fact, being a pharmacist, I've been a pharmacist for almost 20 years, a licensed pharmacist almost 20 years now, or going on 20 years. It's been very, very gratifying. I've worked in various aspects of our field, in a myriad of different settings, and this field is one that is rich with opportunity. And I think that if you look at it in terms of all of the potential that it has, in the different places where you can practice and really show off your strengths, it's very evident that there's never been a better time where we as pharmacists can do that. Like, now is the best time. And I think what happened with COVID and retail, now you see the major chain pharmacies closing, a lot of them closing their stores, the big guys. Now we're down to pretty much CVS and Walgreens. All of the other major chains, have gone the way of the dodo. But I think with that, it's not a representation or indicative of a field that's dying. I think what's happening is we're transitioning to where we've been, or going back to what started our field in the first place. So our profession is one where we are highly engaged, highly connected to the public. One of, if not the most trusted profession, because we deal directly with patients. And if you think about it, you can reach or have access to a qualified pharmacist at any time of the day, no matter where you are. And you have choices. You have a choice. Like, regardless of whatever your healthcare coverage is, you can get competent health advice at any given time of day, anywhere in the country, from a licensed pharmacist. And you probably would say, well, yeah, you're basically saying that a pharmacist, sitting in a working in a retail pharmacy, you call that pharmacy up, you get that pharmacist on the phone, you could ask him pretty much him or her any question that has to do with treatment, in particular pharmacological treatment, and they'll have, pharmacotherapy, and they'll have an answer for you. But that's the thing, it's not just that, because it's not just retail. You can call a hospital, and get transferred to the hospital's pharmacy department, and also get a qualified opinion from a healthcare clinician also in that setting, in a hospital pharmacy setting, where they're going to be privy to a lot of different treatment information because of their practice and where they work. So and then with that's traditional, right? You have your retail, you have your hospital, but then where it's far reaching, it's more than just that. Now students are starting to see more of a move or a call to getting into the research side, the business side, healthcare coverage. There's always been that FDA aspect of it, Federal Drug Administration, and our impact and influence there. But again, there's just a myriad of things that's available, and I'm just glad. I'm glad. I think the opportunity is rich. We have an opportunity to, even for us who are experienced and seasoned in the field, we can transition from where we are, wherever we are, into something else. Vaccines, immunizations, as our scope widens, I don't think of it as a threat to some of the other professions in terms of, nurses and physicians, medical doctors. But I think we are in a special position where, because of our accessibility and because of our knowledge base, I think historically the lines have been drawn to try to protect some of the other professions, the integrity of some of the other professions. But I think doing this, for the most part, by and large, what it does is it ultimately hurts our healthcare apparatus. So the average patient or the average citizen, they are at a detriment by their local pharmacists, or their local pharmacists not being able to provide certain care. And then this varies state to state, right? You have New York. I know of states where pharmacists can't prescribe. Now I'm in New York, so as far as I know here, we don't have this as part of our scope of practice, unless one is privy to practicing at a government-based site where the state laws don't apply. But for the most part, yeah, I mean, it's just very rich. Like we have this huge field that is all encompassing, and it touches all these different aspects of healthcare. And I just think that that it's important that we keep that in mind, and that we promote our field. And even when you hear about people practicing as pharmacists for a long time and then journeying off, or getting into other things, changing their professions altogether, this is great. I mean, again, I don't think it's a knock on our particular field. I think that every one of us has purpose, goals, things that they want or like to do. And I always feel Like, it's more important. They'll tell you, well, to find what you love to do and then do that. And so you never have to work because you're basically doing what you love. And frankly, I don't agree with that. I don't agree with that because you may have something that you love to do and you love to do it. But when you think about it, society in large may not be or may not benefit by you doing that thing to the best of its ability. So, for example, me as a licensed pharmacist, I may love fishing. So I go out there and I find a profession or a job where I get to fish and I get paid for it. Maybe I don't get paid as much as practicing, licensed pharmacist, but I get paid to fish. Now, okay, well, I get fish. Maybe I get really good at it. I teach other people how to fish, right? Maybe I start a business and I employ people and I'm fishing. I love to fish. I start a business and everything that I do now revolves around fishing. Well, now I might be happy doing this, but then the question is, does society benefit the most in me doing this? That's the question. So where do I make my most or my greatest impact? Is it fishing or is it, serving the people of the particular city, county, town, wherever it is that I live? And so I think it's good to do what you love, but I think at the end of the day, we should all love what we do. And at the end of the day, we're serving people. So regardless of whatever we're doing, it's in service. And however you can serve at your highest level, I believe this is what we should do. And I think that pharmacists and all of the different fields where we can practice our skills, our competencies, is ultimately where we have the strongest effect. So yeah, I'm all for, people, moving on to other things. And I think that if you've gotten that far to the point where you're a licensed pharmacist, you are an expert when it comes to drugs and things of that nature, pharmacology, medicinal chemistry, toxicology. You're an expert, and your expertise is lauded. Like, people need your expertise. They need you. And so yeah, do what you love, but rather love what you do. I think it's better if we love what we do, because at the end of the day, it's all about service. And regardless of whatever you do, you will always be at service. You will always be at service. So imagine a top 1% violin player, playing the piano, or like becoming a chef. Like, if you're the top 1% and playing the violin, your greatest contribution is going to be you exercising your expertise in what you're best at. So I'm all for people moving on and trying new things, but let's not forget that our reason, well, let me not say our reason, but yeah, I'm very, very happy. I'm very appreciative for the opportunities that I've been able to take advantage of because of pharmacy and the field. I'm very grateful, and my goal is to help the next potential pharmacists or my colleagues or the younger generation, interns, students, those who are pharmacists and don't know it yet. If I were, Gen Alpha, or one of these, one of the younger generation coming up, what would I need, or what would benefit me? What information would help me make the best decision towards reaching my goals, desires, in terms of my career and things like that. So what I try to do now, or my intention now, is to try to make those things available, for that next person, student, colleague, what have you. Yeah, so pharmacy is very exciting. It's very exciting right now, and there are voices emerging within our field nationally, shedding light on all of the different aspects, different opportunities that we as pharmacists have, where we can make an impact. And it's not traditional. It's not your regular chain pharmacy or independent pharmacy. So many different things that is available to us in terms of our practice. So it's very exciting. I think it's a great time to be a pharmacist. Don't listen to the noise, to the hype. Do your research, get into it. Connect with other pharmacists and other people in our field who are highlighting the different avenues you can take in terms of where you can practice. I mean, you'll find that there's something for everybody. And yes, once you have that expertise, that license, you can then diversify even more, even further, and get really, really focused and really specific with what you do. And at the end of the day, it's all about mastery. It's all about being an expert. And once you have mastery, and once you're an expert, then the sky's the limit, as to what you can provide for your fellow man, whether that be service, knowledge, what have you. So yeah, I mean, I hope this has been beneficial, and I'm going to further dedicate myself to advancing our field, because I feel like our field is a great one, an expanding one, and one that has a lot to offer in so many different areas, whether it be clinical, business, all the different aspects that our field touches. And I think at our very core, at our very nature is that of one of ethics, trust. Because we're highly accessible, because we're usually one-on-one or one-to-one, there's a trust level there. So we conduct ourselves, at least for the most part, as a field in a certain way, because we deal face to face. We're face to face with our patients. We're face to face with customers, oftentimes. And we often hear the pain, whatever the pain is, or what those pains are. We usually hear them, one-to-one, directly, because we're right there with the patients. And we're accessible. So yeah, let's going forward. Let's I don't want to say give back, because I don't feel like I've taken anything from pharmacy. I haven't taken anything away from our field, so I don't. The term "give back" implies that I remove something, but rather, it is my full intention to add and promote to the field of pharmacy this brotherhood and sisterhood that we have, and to academia and the different groups, foundations, clubs that push our profession forward. And I think everyone should, every one of us should be involved, at least in some part, in lobbying the legal aspects to protect, to protect this profession that has been so good to us. Even though historically, there have been times where it seems like big business has taken advantage of what we are and what we do, I think we're coming to a point where we're starting to take that back. Like it's coming full circle. And historically, pharmacy has been it's been a field of apprenticeship, right? Back in the day, before licensing and certification and things like that, if you wanted to be a pharmacist, how did you become a pharmacist? Well, you went to your local pharmacy, you spoke to the pharmacist, you're like, hey, listen, I'd like to learn under you. I'd like to, under your tutelage, learn about this field and, become one who can do the things that you do. And then, you start learning hands-on, as an apprentice, and over time, you wind up becoming a pharmacist through hands-on training, working directly under a pharmacist, which we still see today, right? You still have that aspect of the field today with interns, but I think we're just going back to where things have been, in terms of your local pharmacy being that place where you can go, not just get great advice and great pharmacotherapy, but also, seeing that role expanded to immunizations, direct care, management of things like weight loss, lipid management. The physicians and the doctors, they can't do everything. And again, it's a collaborative effort. I don't think anyone is trying to step on anyone else's toes. But at the end of the day, I think what COVID taught us was that, listen, the public, they need access. They need access. And who is more accessible than your pharmacist? Your pharmacist, by far, is the most accessible, competent healthcare professional available to the average citizen, bar none. I don't even think that's an opinion. I don't have stats to show that, but feel free to look it up, or just measure it on your own and just look around. Urgent care is great. Urgent care, CityMD, these things are more accessible now. They're more available now, especially in the bigger cities. But yeah, at the end of the day, your 24-hour urgent care, your 24-hour CityMDs, your emergency rooms, it's limited. And if you think about it, oftentimes what you'll hear is that low socioeconomic patients are relying on the emergency rooms as their primary care. So they have a particular issue. So because they can't afford health care, for whatever reason, they walk into an ER. They walk into an emergency room, which further taxes the healthcare apparatus. But then at the same time, too, this same individual that's frequenting the emergency room for care could easily walk into a pharmacy, easily pick up a phone at any time of night. If the pharmacy is open, you have your 24-hour pharmacies. And then even if that's not the case, can always pick up a phone. And regardless of whatever one's healthcare benefits are, where they have access to, or someone is either in network, out of network, when it comes to your local pharmacy, those things don't matter. You can walk in, ask your question. You can call, ask a question. Now, of course, not everything is going to be within our scope to answer, and of course you need certain information, labs and stuff like that to give. The more information you have, the better you can give, the better opinion you can give in terms of what someone should and should do for care. But at the end of the day, you want an opinion that's competent. You want a competent professional opinion, and you will always get that with a pharmacist. If it's beyond our scope, we're going to tell you that. You're not going to find a pharmacist who's going to, beat their chest and tell you, okay, well, yeah, do this or do that, and it's something that's it's unqualified, or it's an opinion that's not weighted, in evidence-based medicine. But at the same time, too, your local pharmacist often has access. So where the average person will do a Google search, and Google oftentimes will give you an answer based on influences. So, especially like with AI, especially with the emergence of AI too, I mean, the kind of answer you receive is going to be skewed oftentimes. Whereas your local pharmacist or your pharmacy professional is going to be able to use their experience, their expertise to weigh through all the information and give you a more accurate opinion, something that's more likely to help you in your particular problem. And, not all problems can be solved over the phone. Sometimes you have to go to the emergency room. Sometimes depending on what your situation is, you may have to go. And if you have to go, the pharmacist is going to be able to ascertain the seriousness or the potential seriousness of your situation and direct you in that way. So, yeah, I mean, I'm very happy. I'm very confident in terms of our field and where it's headed. And I think, it's good for us to talk about these things, share information with each other, encourage each other, and to act sooner rather than later. So if you find that you're working retail, or you're in a position where you don't feel like you're getting the most out of it, you feel like you're burnt out, you hear these terms, burnt out and overworked. There are options. Like, don't be afraid of change. Don't be afraid to move on to something different. Our field is more than just the typical or the historical lick, stick, pour, right? We're doing so much more now. So if you haven't been exposed to this, if you haven't been told, like, hey, listen, with your degree you qualify to do all these different tasks and these different positions, you just don't know it exists, where in actuality it does. So you got to expose yourself. And that's the thing, when you're doing the community pharmacy, retail pharmacy grind 8, 10, 12 hour, whatever it is, you don't necessarily have the time oftentimes to do that research to see like what's available to you. But trust and believe it's out there. It's out there, and it's much closer, and it's much more accessible than you think. It's there for you. So I'm working on a book, and it's specifically tailored to pharmacists, interns, students, aspiring pharmacists, because that's who I am. It's what I do. So the perspective is my perspective is one of a pharmacist. But to be honest, the information in the book is going to be beneficial to anyone, all healthcare professionals, and anyone in general who often finds themselves, stuck, not knowing what to do next, where to go, if they feel like they're in a rut and they can't make that next move. I think this book is definitely going to help you, and it's powerful. I'm very excited about the information that I'm sharing in the book. Very excited about what it could potentially mean for those in our field. And I think that some of those principles found in the book need to be highlighted. Very important for us to seize the moment, and to just get out of the hamster wheel, so to speak, to get ourselves back in the now, like in the moment. And that's where we're strongest. That's where we have the most impact, is when we are in the now, seizing the moment that's in front of us. And we've all done this. If you're a licensed pharmacist and you're working, you've already exhibited this. You've gone through an extensive program, a multi-year program. You've gone through some of the most you've gone through rounds. You've worked with clinical teams. You've been in high pressure, fast paced, high paced situations, and you've come out on top. If you have that license, you have that degree, you've come out on top. You've already shown that you can harness the power of now. You can take all your energy, grab onto a moment, and be successful, and transfer or transform that moment into something that's life-changing, something that can change your life and potentially the life of your family and your patients, and your town, your city, everyone that you come in contact with in general. But it's important to realize that seizing that moment and making those decisions when you cut yourself off from all these other possibilities and you focus on one thing, that there's power in that.